everyone, I'm Pragya Kaur, and today I'll be presenting our work, Exploratory Analysis of Nose Gesture for Smartphone-Aided Typing for Users with Clinical Conditions. The most popular text entry methods other than QWERTY keyboards are voice-to-text and gaze-based typing. However, people with medical conditions like sarcopenia, dactylitis, issues with eyesight, etc. find the QWERTY keyboards difficult to use because of its tiny layout. Voice-to-text conversion can be a solution, but noise affects the performance. Moreover, if used in an outdoor scenario, the message can be audible to others. For gaze-based methods to be accurate, mostly commercial trackers are required. To overcome these challenges, we have developed Nosype. The idea here is to use the user's nose tip as medium of contactless text entry. Nosype works in two phases, the draw and the locate phase. In the draw interface, Nosype allows the user to draw out any alphanumeric character anywhere on the screen by moving his or her nose tip in the air. Using an adaptive dwell time, the user can draw at their own pace. Nosype also has an auto-suggestion feature to increase the overall text entry speed. As punctuation marks are difficult to draw and are fewer in number, Nosype allows their selection through nose tip projection in the locate interface. For opening or closing the punctuation grid and adding space to a text, interactive buttons are used, and Nosype requires no additional hardware and works in a standalone smartphone. This is the basic architecture of Nosype, which starts with the identification of nose tip through the front camera's preview. In the draw interface, the nasal movement of the user is tracked by tracking the nose tip trajectory for drawing characters. Once the user stops moving the nose, a convolutional neural network trained with the extended MNIST dataset predicts the drawn character or number with an average prediction accuracy of 87.23%. The auto-suggestion list is then displayed and the user can select one of the suggested word indices by projecting the nose tip. Similarly, punctuation marks can also be selected and the soft buttons can be activated by moving the face towards them. Nosype has been tested through 3 different subjective studies. The first study is the system usability study that aims at understanding how usable Nosype is. For this study, 60 participants belonging to different age groups were asked to use Nosype in their smartphones. 10 of these 60 participants were clinically challenged with sausage finger and other age-related issues and were above 40 years. After using the application, they were asked to fill up a questionnaire based on the system usability scale. In this questionnaire, each odd statement is positive and each even statement is negative. Based on their agreement with the statements, the user had to score them. In the second experiment, 10 participants with clinical issues were provided with Nosype and 3 other applications. The vanilla eye projection uses a projection function similar to Nosype for gaze projection. iSwipe is a calibration-based technique, and cascading dwell gaze typing uses a CNN-based approach for locating the eye gaze. The accuracy of the system was compared through the error between the actual and the projected points. In the third study, with the same set of participants, we have tested the draw module. From a corpus of sentences, the participants were asked to type any 3 sentences with and without the auto-suggestion feature in Nosype. The average system usability scale score was 77.708 for 60 participants, and it was observed that elder users found the system more useful. The figure to the right shows the average question-wise distribution of scores given by the 10 clinically disabled users. All of their scores varied from 75 to 87.5, which was significantly high. By comparing the accuracies of Nosype with the gaze-based techniques, we saw that Nosype clearly outperformed them with an accuracy of 98.14%. An average typing speed of 6.5 words per minute was achieved by Nosype. Comparing the character per minute with and without the suggestion, it was seen that the typing speed significantly decreased without the suggestion feature. To this end, the prototype of Nosype works very well for short messages and benefits the target group of users with medical conditions. Future work will aim at achieving a higher typing speed by the model and adding further functionalities to the system. Thank you.